Now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Talk about the idea of lockdown. It's a word we hear a lot. Tell us what it means and what it doesn't mean, and how far away are we from that?
Well, we're overdue. We're overdue for lockdown. We should have locked down maybe a couple weeks ago. It would have lasted a shorter period of time, and there'd be less damage. It's time to do the lockdown. One of Biden's advisors, I have to wear my glasses today because I took some notes. Oh, Dr. Osterholm, you've seen him on TV before. He said that we are in COVID hell and that we need a lockdown for at least 6 weeks. He's talking nationally. So, but we have got to act fast. 12,000 new cases and 145 deaths, and the hospitals are filling up. That is the key thing. If the hospitals get too full, we're talking about, opening McCormick Place again, and maybe have to use it this time. This is really a crisis. So you really talked about mitigation. How does it work? You have to stop people from moving around. Remember, the main way that this thing is spread is person to person. So you have to stop the movement of people. Essentially, you can do essential things. You can go to the grocery store and pharmacy, try to limit your visits. But, gathering together in any format, restaurants, bars are already closed in most places, gyms and whatever, it just has to stop for a short period of time, 4 to 6 weeks, and we'll watch those numbers come down. It's happened everywhere where they've done that.
We've heard that, restaurants are complaining you're punishing us, but this is driving people to just have more people at their homes or rent out a hotel room, have a private party. How do you keep control of what people are doing inside their own homes, I guess?
Well, that's very difficult. We're asking, or they will be asking people to limit the number of people in their homes. I mean, nobody's going to be pounding on your door, but people, we have to do this together. We can't have the restaurants open during an accelerating crisis like this when the hospitals are filling up. I'm sorry. It's a terrible thing. And I hope the government can give the restaurants and other businesses that have to close for 6 weeks some support. I mean, that has to go hand in hand. With the current administration, that's not going hand in hand. But the administration presumably is changing on January 20th, and maybe we can get something a little bit more coordinated. But 70 days to a change in the national approach, a lot of damage can be done. This thing grows exponentially. That means 1, 2, 4, 8, 16.
Can I ask you if whether it's Moderna, and you could talk about where they're going, or Pfizer, if American companies are making the vaccine, does that mean Americans will get it first, or is there some kind of medical ethics rule that says you've got to distribute it evenly to other countries first? Well,
many of these companies, Moderna is a U.S. company, U.S.-based. They don't really have any presence anywhere outside the United States. They're going to have to partner with some European company to sell the vaccine. But Pfizer and Johnson & Johnson and the other big ones that are in the game now, they have a worldwide presence. They're all making hundreds of millions of doses. And that will get out to everybody. It's going to be challenging and difficult, but it's doable. It is not going to just be used here in the United States. Everybody around the world has a reluctance to take these vaccines. Even in Russia, where it's a disaster over there, but their Sputnik drug, actually showed 92% efficacy in a relatively small trial. But, it's going to be given worldwide.
All right, let's go to the questions. This person says, since the numbers are higher than ever, isn't it clear that all of these new mitigation rules aren't working?
Well, no, they got that backwards. We are not mitigating enough. What we're doing is not working. That's why we have to do something really radically different, or this thing is going to explode. Your hospitals will be full. You're going to get in a car accident. You're going to go there. There's going to be no beds. That's the direction that's happening right now. You remember, as these people get infected today, they don't get sick and end up in the hospital for several weeks. They don't end up in the ICU till the end of the month, approximately over that period of time. So it's a disaster. Like right now, we have to do something immediately. We're not mitigating enough now.
All right, next question. Why does the vaccine have to be kept at 94 degrees below zero?
It's this new one, these messenger RNA vaccines. It's a very small protein, very fragile, and if you don't keep it that cold, it falls apart. So
All right.
it's great, but it's got to be kept really cold.
This viewer says, my sister's family contracted COVID-19 back in early September. They've all recovered. Would it be safe for them to have them over for Thanksgiving? Would an antibody test be helpful in making that determination?
Yeah, it's two good questions here. Now, it depends how they got diagnosed. You want to make sure, were they sick? Did they have a COVID syndrome? And did they have a really good test, like a PCR test, maybe, perhaps? If they really had COVID, they are not at risk. If they didn't have any symptoms and they had one of these rapid tests, I don't know. And the antibody test, that's helpful, but it's not 100%.
All right,
So it
Dr.
depends how they're diagnosed. If they had a good diagnosis, they can come over.
Dr. Murphy, thanks again. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Have a good day.
You too.
Thanks, Doc.